Hi, I'm Dr. Kristi Harder, leading expert in women's health, founder of Dr. Harder's Botanicals, owner of Nest Integrative Medicine in Santa Barbara, and a member of Puria's Science Advisory Board. I've been in practice over 17 years and seen every kind of discomfort imaginable, from acute strains and sprains to chronic, debilitating discomfort that affects a patient's life. As a naturopathic doctor, a registered dietitian, and an herbalist, I offer a unique approach that looks at the body from the inside and the outside. In these next few minutes, I'm going to teach you 3 simple techniques that are wildly successful in helping my patients to prevent and to manage their discomfort. Number 1 is stretching. And you wouldn't think such a minimal task would provide such a great benefit, but I promise you, if you dedicate 5 to 10 minutes every single day to stretching, it will change the way that your body moves. Stretching keeps our muscles and our joints flexible and strong, helping them to elongate fully, so that when we do engage in an exercise or a task that requires the use of our muscles, that we're able to extend fully and decrease injury. Now, when you're thinking about your routine, it doesn't have to be the same day to day, but you want to focus on all of the large muscle groups from top to bottom. So head, neck, and shoulders, chest and back, arms, torso, hips, and legs. I promise if you try it for 2 weeks, it will change how your body feels. Number 2, hydration. Now, we all know how important it is to stay hydrated and drink our water every day. But when we're talking about making sure that we have good joint and muscle health, keeping them lubricated and flexible, it depends so much on our hydration. Our joints all have a fluid called synovial fluid inside, and when we're dehydrated, our bodies don't make that fluid in enough capacity to prevent friction when we're using our joints. Also, the cartilage that's in our joints that acts as a shock absorber, it loses that spongy quality to absorb the shock if you're dehydrated. Also, dehydration can actually pull water out of your tissues and cause overall aches and discomfort. So get in half of your body weight in ounces every day to make sure that you're maintaining good hydration. Number 3, might not be a concept that you're familiar with, but it's hydrotherapy. Now, if you've ever been sitting in a hot tub or a sauna, it's snowing outside, or there's snow on the ground, and you take that inevitable plunge from the hot heat to the cold outside, that's hydrotherapy. It's using alternating hot and cold externally to change our internal environment. Now, there are a few ways that I ask my patients to use these hydrotherapy techniques on a daily basis. The first one is at the end of a hot shower, you would turn the water to cold, or as cold as you can stand it, for 30 seconds. Turn it back to hot for 1 minute. Repeat the cycle 2 more times, ending with cold. Or if you have an acute strain, injury, or discomfort, we would focus on just that area using washcloths or hand towels, hot tap water, and ice cold water to just focus on that local area. You use the same cycle starting with hot for 1 minute, cold for 30 seconds, repeat that cycle 3 times, ending with cold. What happens is the hot dilates the muscles and the tissues, the cold constricts, acting like an external pump, increasing the immune system, increasing metabolism, lowering overall inflammation, and lowering discomfort. Now, in my practice, I would generally add to these things some plant medicine like boswellia or turmeric to help lower overall inflammation and discomfort, but I always give them these 3 easy techniques. I hope you enjoyed. Be well.